Welcome back to Normalized PTSD.
Today we have Dr. Norman again. If those of you who didn't listen to episode 12, you can go back and listen to the umbrella of what is PTSD. So today we're going to be talking about trigger therapy. And trigger, that's an acronym. It stands for Trauma Informed Guilt Reduction Therapy. And you're part of a team that kind of helped write this book. Isn't that correct, Dr. Norman?
That's right. Yeah, I love the development of it.
Awesome. Just to qualify a few things. So this is treating guilt and shame resulting from trauma and moral injury. And I was hoping that you could maybe expound on what a moral injury is, as well as what shame and guilt is.
Yeah, I'd be happy to. So moral injury is an idea that's well probably been around forever, but really taken off in the last decade or so in terms of people hearing the term, it being in the media, in the news, veterans, hearing about it and it really resonating with them. And the idea is that sometimes we get put in a situation that's so challenging to our moral values, that goes so against our values. Either we have to do something or we witness something. And then you have to kind of live with that. You have to be like, okay, wow, I did that, or I live in a world where this happens. How do I go forward? And some people they feel some moral distress, they make peace with it, they move on. But for some people, that pain of that can really last and it can raise a lot of spiritual struggles, emotional struggles, kind of how they see the world can change. Um, and so when they move forward, that one of the things we see is that it could lead to more severe PTSD, depression. Sometimes we see it associated with suicide risk. So this kind of moral injury, this pain, really has a lot of you know correlates that can be very hard to live with.
Right. So shame and guilt, is that always a bad thing?
No, that's a great question. I would say shame is usually a bad thing. Guilt can be very helpful. Guilt can be, like I give the example sometimes, like, I'm driving to work. Well, now I work at home, but when I used to drive to work, I'm driving to work and I have this awful pang of guilt. And I think, why do I have this awful pang of guilt? And I think, oh my gosh, I woke up late this morning. I was rushed. I yelled at my kids to get ready. They weren't yet ready in time. I rushed them out the door. I basically ran out of the house to be on time for work. I didn't even like tell them I loved them or kiss them goodbye. Of course, I'm
Right.
feeling this pang of guilt. That's not the parent I want to be. What can I do differently? I'm going to go to
Mhm.
bed earlier. I'm going to get up a little earlier. I'm going to like set aside 10 minutes just to be with them. So that is an example of guilt being used adaptively. There's nothing bad about that kind of guilt. What I did was I took that feeling seriously. I examined it. I said, what did I do that went against my values? What did I do that made me feel bad? What can I change? And so guilt can be that like that. It can drive our behavior in a good way. It could be adaptive. But when it's associated with something as big as a trauma, like someone died and I feel responsible,
Mhm.
um, that's a whole different level. And when we don't examine that guilt, and when we have that awful feeling of guilt, and we take it as evidence that we did something really bad, and it starts to change how we act in the world. I don't deserve good things because of what I did. I deserve to suffer. Then you can see how it can be incredibly harmful to someone's life and very hurtful and not have that kind of positive outcome. And so
Right.
that's the kind of guilt we're really wanting to approach and trigger. If someone's having a positive kind of guilt, they don't need, to come in and see me. But if someone's really suffering because of their guilt and it's affecting their life, their happiness, their relationships, their work, that's what we want to see. And so to me, if you look at the research, the way guilt and shame are defined are a little bit all over the place. So we wanted to be very clear on our definitions and very consistent in our work.
Right.
And the definitions that we found that we thought were really appropriate for what we were doing is guilt is that I did something and I feel bad, and
Mhm.
shame is I did something and I am bad. So shame is when that feeling of guilt becomes the whole person, their whole value, who they are. I am bad because of what happened. That's shame.
Just to give an example, I think that's going to be pretty relatable to many that listen. For a moral injury would be taking a life or losing a life, something along those lines. It seems to be a really common theme, at least with the people I've been speaking with. And then things that may be associated with that would be shame, like in the sense of like, you take on all the ownership and responsibility of that situation. Is that kind of like similar where we're going with this? Like, for example, like I saw some children die when I was in
Yeah.
Iraq. And then I took on the ownership of like, that was my fault, even though I wasn't the one responsible for the ambush. I wasn't the one responsible for the IDs going off or anything like that. But I took on that shame and guilt to where even nowadays, if I'm around kids, I'm very uncomfortable, like I'll have my god kids kind of like bump their knee or something. And instead of it being a situation where I see a small child just bump their knees, I carry the shame and guilt from that situation in Iraq, and I apply it to kind of that situation.
Yeah, that's a really good example, both of a situation and of the lasting kind of consequences we see that cause people so much pain now, even though what happened was years ago. And I think when children are involved, it's extra hard, and we hear that a lot. Um, Running a PTSD treatment program for veterans who served in Iraq and Afghanistan, that's how I became interested in doing this work, was I was seeing so many people come in and their main struggle being this kind of guilt and shame. And we had a few people come in who would tell us of incidents of having to kill a child because, they weren't following orders to stop. They had things on their body that, were
Mm-hmm.
ambiguous. They were told, over and over. They kept approaching. But then we had someone come in who was like, you know what, I didn't. I froze because it was a child, and I put my entire unit at risk. And um, all these bad things could have happened because I froze and I couldn't do my job. And so to me, that really brought home too, just, in war, people are in these impossible situations sometimes. And there's no right answer. There's no, if I do this, everything will turn out fine. And so you put people in these situations. Often the people telling me about these stories, when stories were happening, they were like 18, 19, they were children themselves practically. And now they have to live with this for the rest of their lives. So it's just so complicated. And, to your question of, is killing sort of the issue? Sometimes, yes, sometimes that's exactly what it is. It was civilians, it was children, it was outside, the rules of engagement. But sometimes it's something else. Sometimes someone will come to me and say, like, no, I knew this could happen when I signed up for the military. It was all, within the day's duties, but I felt nothing, or I enjoyed it at that moment. What does that say about me? That's the guilt. I'm a monster because I enjoyed it. I mean, those are the kinds of things I hear sometimes. So what I've learned over the years is it might not be kind of that surface level, more kind of like obvious, like, oh, I killed someone, so I feel guilt. That might not be it at all. It might be kind of a few steps deeper than that.
Right. No, that's a really good point. Like, uh, I just hope all the listeners know that when we give examples, it's not saying that this is the only example. It's just to give one so that there's a little bit more relatability to that.
Yeah, absolutely. I mean, we've heard thousands and thousands of stories from people at this point. And I really want to echo that, Jonathan, that like, there's no one thing. It's all what people tell themselves, how they process the event. And we've heard so many different stories, or we've heard similar events, and some people are fine, and other people, what distresses them about it is completely different than the person who is standing right next to them. So there's no one way to react. There's no right or wrong way, but we
Right.
see the people who somehow respond in a way that causes them ongoing, very severe suffering. And that's what we want to help with in this therapy.
Absolutely. And a lot of people that I've talked to, they don't feel like maybe they have experienced that level. Like they didn't achieve the bar, like no one died. But the thought of they didn't do anything and potentially it could have, even that could be like their bar, that might be the trigger that caused all of the trauma and the continuous trauma and symptoms. So it's just like you said, if you're experiencing trauma, you're feeling that guilt and shame, go find help. But to that, I would say, like, for me personally, like, I felt it for so long it became chronic, and maybe it felt like my normal, like that was my normal way of feeling. If someone is really curious if this is something that may be applicable to them, what are some tips that you would give them to be like, hey, these are some signs that you may see if you're experiencing chronic guilt, chronic shame? Like, what are some traits they may do? What are some things they may like avoidance, things of that nature?
Yeah, that's a great question. So a few of the things we see is a lot of times at the basis of guilt and shame, there's a belief that I should have done something else or I shouldn't have done the thing I did. So if that's sort of playing for you, like I shouldn't have just stood by, I shouldn't have, you know, I should have told him to stop, I should have done this, I should have done that. And that's like really kind of in that loop and part of those feelings, that's a sign that there's guilt and shame present. Um, the other thing we see is that people who really have this very prominent guilt and shame, they often have mixed feelings about feeling better. So, for example, they might come to me in therapy and say, I'm here because I feel so awful, but then they don't show up half the time or they don't do some of the work. And so the way I take that is they're ambivalent. They have mixed feelings. Part of them doesn't want to suffer anymore. And then some other voice inside of them is telling them, no, you deserve to suffer. You don't deserve to feel better. Or some of the other kinds of things people have told me, because we actually explore this very out in the open in the therapy, is what function is the guilt and shame serving? And some of the other kinds of things people say is, well, if I didn't feel bad, I wouldn't be honoring the memory of the person we lost that day. Or then what would
Right.
stop me from doing more bad things? Or, so that guilt is playing a very real purpose. And we need to look at that in the therapy, because if we just try to take it away without addressing that, that's not going to work. Because it's serving an important function. So we really need to work on that together, making sure that function is met in some way that doesn't involve this kind of deep, deep suffering that they've been feeling. But those are some of the signs. Some of those kinds of thoughts might be signs that there's, if you think part of you thinks I don't deserve to be happy, I don't deserve to feel better. That to me is a very clear sign that there's some guilt and shame going on.
Right. And that was the point I was thinking about earlier when I got a little bit distracted, was sometimes carrying that memory carries, like, to them, it's like, okay, if I forget this shame and guilt, then I forget that person, and
Yeah.
I know that a lot in at least my career field, that there's some that carry that burden. And I feel like in your book, and I'm sure we're going to speak to it eventually today, that there's ways to deal with or to hold that memory of that individual in a healthy way where it's not impacting your life negatively forever.
That's what we try to work toward. We never tell someone stop doing this, because that doesn't work and they
Right.
just think we're ridiculous and they don't take us
Exactly.
seriously.
Yep.
So we never do that. But in the course of the therapy, we work with the person who's with us to fill their life in other ways that meets those values, that meets those goals. So that at the end of the day, their life is full and they can say, okay, I'm honoring the memory in this way. Maybe I can let go of that guilt a little bit, but that's all in their sphere. I don't force
Right.
someone to do that.
Absolutely. So with that, let's dive into TrIGR a little bit. So where did the idea come from?
Yeah, so I was running a treatment program for veterans who had served in Iraq and Afghanistan. And again, I was seeing it. I was supervising a lot of people, a lot of therapists, and they were saying, these people are coming in. It's not that they're fearful or anxious, like we sometimes see with PTSD. This could also shame and guilt can also be very much PTSD, or it could be its own
Mm-hmm.
thing. But they were sort of saying we're seeing so much of this and we need more. We need more help treating this effectively. And I had worked with a really brilliant man, a psychologist who'd been at the National Center for PTSD in Hawaii, Edward Kubaini. He's now long retired. But he had done a lot of work on guilt and shame with Vietnam era veterans and with women who'd been abused, also
Mm-hmm.
carry a lot of guilt and shame very commonly. So he'd worked with those two populations and identified kind of common sources of guilt and common ways where people feel guilty and shame, where they're not looking at the whole memory, the whole situation, and had a lot of great strategies and great language. And so I reached out to him and I started with some of what he had put together and kind of built on that to put the TrIGR protocol together. And so part of it is this kind of like, we know that people who feel a lot of guilt and shame, that feeling is so distressing and they feel it every day, but they often haven't really like delved into the whole memory, exactly what happened, because it is so distressing. And so
Right.
we kind of work through that with people because it's tough, but we're like, let's really look at what your options were. Let's really look at what you knew at the time. Because so often we do that like Monday morning court, like, quarterbacking or whatever. We're like, wait,
Right, right.
I knew what, why did they do that? Why did they do that in the game? Like that was, I knew they were going to lose.
Mhm.
So we kind of like knowing what we know now, we sort of tell ourselves we knew that beforehand. And so we help people kind of look at that. Like, what did you actually know going into the situation versus what you're telling yourself you knew now based on how things turned out? What are you, what other options really were there? Because you're telling yourself there was something you could have done where everything would have turned out better. Let's see what options you actually had and play out how those might have gone. And often
Right.
people kind of realize like, yeah, there was no way to save the day. Something bad would have happened no matter what, right? Maybe something different bad,
Exactly.
but you know, and then we say, okay, you've been telling yourself how it's your fault. Like, yeah, you were there, you had some responsibility, but in life, we know it's never just one thing. So let's look at what else contributed. So we just fill out that memory, fill it out to the reality of all the things going on to help that person have like a kind of like really have a more like truthful perception of what they could have done, what their role was, how they participated. But what we found is that alone, sometimes people are like, oh my gosh, I couldn't have done anything differently, or
Right.
I did the best I could. But that's not enough. What we found is, again, that guilt has a role. So they're not just ready to let go of it because it's honoring that memory or it's serving some
Mhm.
other function. And what we found is that, people are suffering because of that moral injury, because some value that's very important to them was violated. And so what we can't change the past, but we can help them figure out what are your values that matter to you a lot. And look how much you suffer when a value that you hold deeply is violated. Let's take a look at what some of those important values are to you and build them into your week. So, into your day, into your week. So you're working toward things that are really meaningful to you. You're doing something every day that is really meaningful to you, whether it's about your family, your community, your relationship, your work. You choose. We'll work together to help you choose, but let's make every day feel meaningful. And so those are some of the core things we do in the intervention is help someone really understand what happened, what their role was, help someone understand how the guilt has been serving them, what function it's played, and help
Mhm.
them live more closely to their values.
Have you, in your study, found that people suffering with guilt and shame tend to, I guess, hold on or be in the negative atmosphere with PTSD for like longer periods of time? Like, I think I read that it was either in the book or in an article related to this, where it was saying like, if they have shame and guilt, those two are problematic for PTSD symptoms being even longer because it's harder for people to let go of.
Yeah, what we've seen across a number of studies is what we refer to as positive associations. So
Hmm.
basically, the stronger the guilt, the more severe the PTSD symptoms, the more severe the depression symptoms,
Right.
maybe the worse the functioning, like sort of day to day, feeling like you're functioning well in your work, your relationships, other things that matter. More likelihood of sometimes like suicidal ideation, thoughts of suicide. That doesn't mean that it's true for every single person at all. So, anyone who's listening, that may or may not be true at all,
Hmm.
but it means that across a number of people, when we have 100 participants in a study, we see these correlations, right? We see a positive
Right.
correlation where one is related to the other. It doesn't mean one's causing the other. We just can't tell that from that kind of research, but we see there's something there.
Okay. So someone is going to start doing trigger therapy. What can they expect for the length of, I guess, what would you guys call the 7 week course? Like, there's a session, I guess, and it would be how many sessions per week? Like,
Yeah, so we like a therapy session is what we call it, and TrIGR is supposed to be about 6 or 7 sessions, and traditionally it's been 90 minutes. We're actually reworking the protocol now, so it'll be 60 because what we found is in a lot of healthcare settings, it's hard to schedule the 90-minute session. and insurance doesn't always reimburse more for the 90-minute session, even though the therapist, loses another hour potentially. So just sort of our healthcare system is designed more for 60-minute sessions. And so we're finding that it actually works really, really well with the protocol to do the 60 minutes. So we're really excited about that. Because at the same time, also, the clients are telling us like, hey, I'm trying to do this in my lunch hour. I don't have 90 minutes, So everyone's sort of telling us like 60 minutes is better. So we're really excited about that. But yeah, 6 or 7 meetings. And it doesn't mean, sometimes people are like, that's great. I'm busy. I need to get on with my life. And sometimes people are like, no, that's not enough. I need more things. And so at the end, we absolutely work with someone to figure out like, do they want to just sit with what they've learned and TrIGR for a while, see how that changes their life? Do they have such terrible insomnia or anger or something else that they want to go on to more therapy, either with one of us or with another therapist who specializes in that? We kind of help people figure that out. But what we've seen with TrIGR in the research is it does, for many people, reduce guilt and shame. It does for many people help with PTSD symptoms, with depression symptoms. That doesn't mean it will for every single person, but again, on average, it's helpful.
Okay. So I believe when you break down TrIGR, there's module 1, 2, and 3. We really hit on 1 and 2, which is what is traumatic guilt and shame, some of the problems with, to, debriefing the situation, kind of seeing it through, I guess, not realistic, because I feel like that's demeaning, but maybe a more appropriate glasses, so you see it like
I almost think of it as like a broader lens. We all have like our line of vision, and we're just trying to make it broader.
Okay, right. In my head, I'm a bit silly, so like I know my mind's a bit dramatic at times, so I correlate with like Uncle Rico from Napoleon Dynamite, talking about how if Coach put him in, he would have won state. We all know if Coach would have put him in, he wouldn't have won state. But like the mind just like expounds on these possibilities, what could have happened, and it gets to the point where it may just be a little bit different than what really happened. So that would be like the module 2, where you're like, hey, okay, so what really happened? But module 3 is what stood out to me, and it's something that keeps popping up in, like, whether it be a retreat or some sort of meditative practices. It's all about living a purposeful life. And what does it say here? Living a value-driven life and setting value-driven goals. Could you speak to that a little bit? Maybe give like an example or two?
Yeah, so that is very individual, right? Like if I see 5
100%,
different
right.
clients, the plan, the values they're going to highlight, the plan they're going to come up with is going to be 100% different from the other 4 people, most likely.
Right.
And so this fits into that part of the therapy I mentioned, where it's sort of like we turn from, okay, we understand the past better, we understand your role, we can't undo the past, but we do see how deeply you suffer when your values are violated. So let's look at what some of those values that are so important to you are, and let's look at how we can build them more into your life day to day. And we do a few exercises, because it's not like if I'm like, Jonathan, what are your values? You're like, well, let me list off 10, and then we don't work that way, right?
I have a list prepared always. Yeah.
Right.
Exactly.
I wish I did. I don't. But so we actually have some exercises that kind of help pull for that. And some of them, if any of your listeners are familiar with acceptance and commitment therapy, they use some of those principles to help people identify values. So we actually have like a worksheet where we help people think about just even the different domains of values. Because when I think values, I don't know what I think, but then when I start thinking, what matters to me in my place of worship? What matters to me in my community? What values to me? What I want in my career? What would make me feel like I had a really meaningful career? What would make me feel like I was a parent who parented in a way that's really important to me? So when you start breaking it down, it's easier for people to start having a conversation with you of like, well, as a parent, I really want to, be at my child's games. I really want to do this. Like you can start finding examples. And then we also try to think like sort of big picture, like maybe it's like really important for me to give back in this way. Well, that's a huge goal. But this week I can look at, philanthropies that do something related to that. And next week I can call a couple and see what kind of volunteer work they have available, So we sort of set the lofty kind of big picture value. And then we think about like goals that would feel great. Like, oh my gosh, I actually like talked to someone today and they told me how I could volunteer. And this feels so meaningful. Like we give people activities. We help them figure out activities that fit that bill of helping them live a more purposeful life.
Right.
We also kind of help them think big picture. Like there's some exercises around like, it's your retirement party. Like you've worked all your life and people are throwing you a party and different people that you've worked with are getting up and talking about the contributions you've made. This is like in the future. So what do you want that to be? Like, what would it matter? Like, what would you like to hear? And so, that's just a couple of examples, but we have different ways to help people kind of, again, think about like what would feel like a meaningful life to them, because we know it's different for everyone. And then we help them set goals and we help them be realistic because things get in the way, right? Life gets in the way. You get COVID,
Yeah.
100 other things come up, whatever it is. So we know life's going to throw that at you. And so we help them plan, like when life throws whatever at you, how do you not let it derail you? How do you get back toward living this purposeful life?
Exactly. No, I love it. I have a friend that just joined the other day and he was talking about how routine really helps him find purpose and like, I guess, really maximize his time. But he's like, but it can't be super strict or rigid because, life happens and you don't want to feel
Yeah.
guilty or shame. Be like, I couldn't go to jujitsu today because, my dog's sick. It's like, it's okay. It's like there's jujitsu tomorrow.
Yeah. Yeah. My flight got canceled. That's a big one right now.
Right? I know it's happening a lot. So we talk on the book just briefly. There's a book out that talks a lot more to this. It's not exactly for me, I would say, but I found a lot of value in reading it, as well as it gave me a lot of, things to think about. And like, you gave me a different perspective of guilt and shame for sure. I just feel like it's for a doctor from a doctor kind of thing. But if you just talk about where we could find that book.
Yeah, any major bookseller online will have it. It's called Trauma Informed Guilt Reduction Therapy. I'm the first author, Sonya Norman, and then my colleagues are who've contributed in very important ways are on as well. It is, you're right, Jonathan. We haven't written the sort of lay version yet, and we really need to. But the first thing we wrote was therapists were saying, I want to do this. I have veterans coming in. I have first responders coming in. I have, first line healthcare providers coming in who are living with this kind of guilt and shame. How do I, what can I do? And so the first thing we wanted was a really clean kind of manual of like, how do you deliver this? And in the book, we also have just chapters on sort of who's a good candidate, what are kind of some of the obstacles that can come up in therapy, sort of just helping the therapist who is learning the therapy through the book, get through, whatever might come up and deliver the therapy well. And also there's some chapters just more generally on understanding guilt and shame and the research we have to date on guilt and shame. So it's a pretty thorough book, but it is written for healthcare professionals to be able to deliver the therapy. And it is my goal to write something for people who are very interested in this, either because for personal reasons or for family members or for whatever reasons, but who aren't healthcare professionals. So I hope we can do that soon.
I for sure got a lot out of it, but it's like I don't know I color really well. I stay in between the lines, and I feel like I spent a lot of time researching like what does that word mean, but it still gave me a lot out of it, at least to speak educated about it. I feel like to get more information to break it down a little bit more.
Yeah, and we have that article that I shared with you too. That's more of a summary. So instead of like a 200-page book, it's like a 10-page article. And that's
I was
I'm
gonna add that to my it'll be linked to whatever I release, that article.
I would say, yeah, any of your listeners who are interested in learning more, I would start with the 10 pages. It'll give you a lot of information without sort of all the maybe more academic stuff that's in the book.
Okay, so the first one that I wrote down while we were talking was shame and guilt. Someone that feels shame and guilt has already, I feel like, reviewed their situation, judge themselves and see themselves in some sort of negative light in some way. So that individual who's already carrying that, trying to come to a doctor to speak to this topic of shame and guilt, that can be really hard to do. What are some things that you might tell someone who's struggling with shame and guilt to like maybe inspire them to like come seek help, be like, this is a judgment-free zone. It's fine. It's safe, because the worst thing in my life before I started doing therapy was someone to confirm that I was a monster for some of the things that I did,
Right.
So I was just wondering if you had any ideas or like encouraging words to give someone for that.
Yeah, that's a really good point. We see that a lot, where people are really scared to share what happened. It's the thing they feel the most shame about in their entire lives, and they're just going to come in and talk about it. That's a big ask, right? That's really hard. Um, and one of the things that I've trained everyone on my team on is working with that ambivalence. So sometimes we'll, for example, get a call and someone will say, I want to come to your clinic. I want to be in your research study. Um, and then they're like, actually, I don't, right? And we sort of see this like back and forth, and
Yes.
we're okay with that. We get it.
Mhm.
We get that that's part of the process. And so we've actually trained all our staff, even the ones who aren't mental health professionals, but who more like pick up the phone and do some of the screening questions and things like that, to work with that, to expect that it's normal, to be accepting of it, to say, hey, can I check in with you in a couple of weeks, to just be really warm and accepting. Um, I think also because maybe people know that we do this work, they know we hear everything from everyone. So I think maybe in some ways it's a little bit easier to share with our team than it is with someone who you don't know, do they hear stories like this? How will they react? But it still can be very, very hard.
Right.
And someone, usually the people who come to us, they really feel like they've done just the most horrific thing. And so seeing how we react is very big, and then
Mhm.
seeing how we work through it. And I mean, we've worked with people who, we've worked with thousands of people at this point. And one thing I'll say is that, no matter what it was, if they're feeling guilt and shame and they're suffering, that suffering it radiates so much. It's causing them so many problems. It's causing their families multi-generational problems because they're bringing those emotions into their children, to their spouses. It's affecting their ability to be like a productive member of society because they're struggling at work. Like, we don't care what the event was. We're not judging. We're working with that guilt and shame and helping that person, you know, find some relief, be the parent they want to be the productive member of society they want to be. That's where our focus is.
Uh, I don't know if this is just something I saw recently, but I think it's curious. I wanted to ask you about it. But I feel like changing negative to positive is a lot to do with perspective. And I was just wondering, do you think that there's any substance in the fact that someone who's able to see a situation in a positive perspective early, like that does, like, because not everyone that goes through a traumatic situation results in PTSD. And I'm really curious if that's because that person's able to see that situation in a positive light, whereas someone else may initially see it in a negative light, which the brain trains itself and conditions itself and just reiterates that it's negative, it's negative, it's negative until they start seeking help. So then you have this neurological like conditioning of seeing that as negative, and it's really hard to change the way you think and change your perspective on that. Like, I don't know, that maybe that's just the way that I saw it in myself and when dealing with trauma, but I think I'm just saying that to like, don't wait, like if you're seeing something in a negative light,
Yeah.
the sooner the better is what I hear from everybody.
The sooner the better. And, some people do, when you say see it in a positive way, some people do have this reaction where they're like, oh, I almost died. I'm
Right.
going to change everything and move, to the mountains and live this other life. So maybe that's an example of that. For most people who go through trauma, it's a horrible thing and it's a horrible memory. And it's often the worst, if, one of the worst, if not the worst thing that's ever happened to them. And that's okay that is what it was. And it's okay to see it that way. But if you're having, the symptoms of, um, avoidance and fear and shame and guilt and anxiety and depression and you want to use drugs to cope, any of those, not all of them, but any of those, if you're just miserable, and some time has passed and you're still miserable, it's 6 months later, 5 years later,
Hmm.
like get help. Yeah. And we're not going to, in therapy, we're not going to say, like, let's put a positive spin on this. What good thing came out
Right.
of your trauma?
No,
We're never going to
yeah,
do
that'd be
that.
horrible.
Yeah. No, we're going to acknowledge that what happened to you was horrific,
Right.
but we're going to help you live with less pain now.
Right. The big question that I've been wanting to ask most of the doctors I talk to now, and moving forward, but if someone comes in to get help and they're purposeful about it and they're intentive and, you give them, I'm sure like everyone else, like I had homework when I go to therapy or something like that, but as long as they're like actively pursuing help, how often would you say that that person doesn't get better?
We have statistics on that. So, not all treatment is created equal. And, last time you and I talked,
Right.
in the last episode, we really talked about getting the evidence-based treatments that are solidly well researched and we know they're effective. With those therapies, I think, something like 60% of people, if they have PTSD, lose their PTSD diagnosis. A bigger number than that, 70 or 80% feel better. So maybe they still technically need
Hmm.
PTSD, but day to day they feel better. They're doing more. They're functioning better. So most people feel better. I think the rates are similar with
Hmm.
help for depression, whether it's therapy or medication. Um, and we've also seen that sometimes people don't respond to the first treatment they get, but then they respond to the next treatment they get. So if one
Right.
episode isn't successful, try again. Don't give up. Don't feel hopeless. Some veterans came to the VA years ago, especially like from previous conflicts, like maybe Gulf War or Vietnam. Um, and the treatment, we didn't have these treatments. We didn't know much about them then. We didn't have them widely available yet. So they felt like, oh, I came to the VA and it was kind of pointless. Um, or I tried treatment and it didn't work for me. I so encourage you to try again because we've learned so much and we have these treatments so much more available now. So like prolonged exposure, cognitive processing therapy, EMDR, TrIGR, we have, it's the new kid on the block, but for those with a lot of guilt and shame, the research so far suggests it's good. Um, so, there's different options. There's also medications that work well. I know I'm recapping from last time, but I just really want to give your listeners hope.
Yeah, don't give up. And that's basically all that question was for. I feel like if you want to improve the quality of your life, you can. It's not always easy, but yeah, if you want to do it, you can for sure. But yeah, with that, is there anything else you'd like to touch on with TrIGR that I may have missed?
No, you ask great questions. I always enjoy talking with you, Jonathan. Thank you for having me again.
I enjoyed it too. It was a blast. And with that, we'll wrap it up.
And with that, we're going to wrap things up. If you ever have any questions or ever looking for any more information, just look in the show notes. I try to link all the resources on there. Or if you want a more personal response, just hit me up on Twitter, Facebook, Instagram, or anything like that. I hope you found something positive out of this and walk away with a little bit more knowledge. And we'll chat with you soon. Bye.